So today I'm going to be talking about a total knee arthroplasty. This is when the femur and tibia are resurfaced, and in a tricompartmental arthroplasty, the patella is also surfaced. So in this surgery, we would correct deformalities, decrease pain, improve function, improve range of motion, strength, and joint stability. The most common procedure that surgeons tend to do is the paramedian approach, where they make an incision on the anterior quadricep. They follow that line down to the patella and go medially around the patella and continue on the anterior side of the tibia. So in this surgery, you can either have a PCL sparing or they will take out your PCL. It just depends on the function, and there are different benefits to each one. So also there will be either non-cemented or cemented layer in between the surface and the bone. Non-cemented is usually lasts longer, but it requires a longer rehab, and there is more weight-bearing restrictions on it. In the cemented, it's usually for the older and overweight patients, and this is the gold standard as of now. There are a couple patient-controlled medicines. You got patient-controlled analgesia, peripheral nerve block. You have opioids and NSAIDs. Also, there are some complications with this surgery. You can have stiff knee. You can have nerve injury. Infection is always a complication with surgery. There can be a quadriceps tendon rupture or a deep vein thrombosis. Some devices to help with these complications. You have your TED hose, just compression socks. We can as PTs, we can teach the patient ankle compression pumps, or they can be on blood thinners. TED hoses are also good for edema control, and there's neomobilizers as well, which promotes extension while sleeping or just when you're laying down in bed. There are active passive motion devices. We recommend not using these because this promotes bed rest and it's bad for the muscles. Some other precautions as a physical therapist we need to be aware of are weight-bearing restrictions. We have to follow whatever the MD orders are. We should not put pillows under the operative knee, as this will promote stiffness and extending. And we should not use heat, which this will promote swelling. And there should be no pivoting or twisting on the operative knee. So the patient may also need some mobilization techniques to help them with their daily life, like a walker, or if they need crutches. PTs, we should be able to teach them fall prevention, help with range of motion and flexibility, and strengthening their muscles, and just functional mobility, daily stuff around the house or in their daily lives. So one of the big problems with the TKA replacement is the ability for the patient to do activities at home, or simple activities, including putting their pants on. And that's what I'm going to show you now. In this next situation, this is a normal person with no total knee replacement putting pants on. In this next clip, you will see a patient that had a TKA and is struggling to put pants on, and is trying to follow the restrictions listed by the PT and the MD. As you can see, the patient is now trying to put a pants on his operative leg. He slides up the full pant leg on the operated leg and then continues to insert on the non-operated leg. To stand up, he will have a slightly bent, slightly in front operative leg and use majority of his non-operative leg to get him to stand all the way up to put his pants on.